Mental health and wellness, the importance of sensorimotor art therapy, using clay therapy, and addressing the complex needs of children who have experienced trauma affecting their mental health and developing symptoms of post-traumatic stress disorder. 18% of children and adolescents are now dealing with serious mental disorders requiring immediate clinical attention. Art therapy can help alleviate emotional symptoms, as it is an approach that utilizes the expression of emotions in a nonverbal manner. They utilize neurobiological mechanisms that can alleviate suffering by accessing nonverbal feelings in the right hemisphere. Trauma can severely impact young individuals, leading to difficulties in verbal communication, emotional regulation, and cognitive processing. Children diagnosed with post-traumatic stress disorder, PTSD, are those who have experienced or witnessed trauma and suffering from symptoms that trigger related experiences, bringing sensations of pain, fear, horror, and anger. Some of these children may also develop other disorders such as depression or anxiety. Sculpting clay can enable children and youth facing mental health issues due to trauma to mold their feelings into art, providing a therapeutic path for healing and self-expression. Sensorimotor art therapy offers a nonverbal outlet for children to express their emotions and experiences, which is especially beneficial for those who struggle with verbal articulation. The hands-on nature of working with clay involves sensory and kinesthetic processes, helping regulate the nervous system and reduce anxiety and hyperarousal in trauma-affected children. This therapy facilitates embodied healing by allowing children to physically manipulate the clay, aiding in accessing and integrating implicit memories, leading to deeper understanding and trauma resolution. This holistic approach assists in trauma processing by engaging the child's physical and mental faculties, facilitating emotional healing and development, as well as helping children recognize their feelings and sensations, reduce stress, and promote mindfulness. Process and heal from traumatic experiences. Integrating sensory input with motor actions, clay field therapy promotes a connection between the brain and the body that can enhance emotional well-being. Case example, a child and youth care professional is working with a child aged around 6 to 8 who experienced a traumatic situation and developed PTSD with anxiety symptoms. The child is not ready to talk about what they have experienced and is uncomfortable with traditional therapies such as psychotherapy. They also find it difficult to relate to others, can't sleep, suffer from neuritis, and underperform at school. With their holistic approach, focused on one-on-one interaction with the child, the CYC professional can use sensorimotor art therapy to assist in therapeutic work. In this case, encouraging nonverbal expression through art, such as working with clay, can be integrated into the child's daily or weekly routines, such as at school. This is particularly beneficial for those who have difficulty verbalizing their feelings and experiences. Like the child in the case, this nonverbal expression allows individuals to process and communicate their feelings in a healthy manner, benefiting those who struggle to articulate their emotions. Setting aside specific times and places for creative activities provides a safe and structured environment for self-expression and emotional release, helping establish a routine that supports emotional regulation and mental clarity, which can also be beneficial for this child. In this way, the CYC professional can use clay modeling therapy as one of the therapeutic approaches with this child, in an empathetic and respectful manner that respects the child's pace, asking open-ended questions or about symptoms without forcing the child to talk about the trauma. Through modeling therapy, the child can gradually process events, bring unconscious elements into the creative pieces, reshape their story, and recognize their strengths and abilities as a survivor of what happened. The role of the CYC is to focus on strength-based approaches, holistically providing resources based on the child's needs. This wellness practice has a calming effect from the repetitive molding movements and can be very reassuring, helping to reduce children's anxiety. As children feel safe and supported, they can bring and explore their emotions and feelings, thereby recognizing their strengths as survivors and redefining the traumatic experience.